Hi. So this is going to be a video directed towards any friend, family member, neighbor, or just anyone in somebody's life who has Crohn's or ulcerative colitis. So if you know someone or you care about someone who is a Crohn's or UC warrior, please watch this until the very end. It is very important. There may be words in this video that kind of gross you out. Warning you now, it's about anatomy. Please be an adult about it and just listen. So, inflammatory bowel disease is nothing to shrug at. It's not something that we can will away, and it's not going to get better just because we're young and we should be healthy. If it bothers you and you're not the person experiencing it, imagine how we feel being unable to do things on a regular basis. And just a side note, inflammatory bowel disease and irritable bowel syndrome, two completely different things. Please do not confuse them. IBD is an autoimmune disease, which I will be talking about with you today. IBS, no, it is not autoimmune, and it can be treated much easier than IBD. So I'm going to try to help you understand our world for a moment. And please really try to put yourself into the position that I am about to describe, because this is our daily reality. And yes, mild to severe cases, all, can be this bad. Okay. This is you. And I want you to imagine you have been stabbed, but not once. You've been stabbed in your mouth, in your throat, stomach, intestines, liver, kidneys. You may be stabbed numerous times in the same place. You can even be stabbed in your exit hole. Each of these knives is insanely painful because this knife, first of all, it is an insanely dull blade, and I don't know if you know this, but the sharper the blade, the easier it cuts. So the duller the blade, the more it's gonna hurt when it goes through anything. This is the dullest blade you can imagine. And it's got barbs all around it. Okay? So you have a bunch of these blades throughout your entire digestive tract, from your mouth down to your anus, and in some other areas we will get to. Each of these, as I said, is insanely painful, and you can have more than one in one spot. There is no way that you can remove these knives. None. You cannot remove them by yourself. The more you poke them, accidentally bump, try to remove them yourself, or you even try to ignore their existence, they hurt more. They're going to remind you that they're there every day. Every time you move, every time you breathe, they hurt. They make you bleed internally. The blood is not going to come out where they're poking from the outside. It's all inside, and it's all coming out your back door. The brighter the blood, the closer the knives are to your back door. But sometimes you might spit blood because you've got sores in your mouth that are also bleeding. Sometimes the knives will rip through from one organ to the next, and you get tunneling infections and abscesses known as fistulas from those organs sharing fluid. Imagine you have a knife in your intestine and it has shredded your intestine so bad that the knife has fallen through and punctured your bladder. Now you are peeing poop, literally. Imagine having it burst through, for females, to your uterus. Now you're getting a period of poop, and it's insanely painful. Or your skin can try to remove this abscess or fistula, but now you have an open sore on the surface of your skin that is almost impossible to heal. Only you can see these knives sticking out of you. Your doctors, your friends, your family, neighbors, they all tell you this pain is in your head. Get over it. This isn't real. You're dismissed for weeks, months, years. Despite losing blood, excruciating pain, and an inability to control where those knives are and how many times one place is stabbed. Completely dismissed. You can't take normal painkillers either. They feel like acid is slowly eroding the blades. It makes everything worse. And it thins your blood more, which means you're bleeding more, which means you're more anemic now, which means you're weaker. The people in your life will tell you, just eat healthy, but you know that salad is gonna get stuck going all the way down. Fruit gets stuck on every blade. So many things that you try to eat, you cannot eat without pain from start to finish. It's impossible. Everything, chicken, beef, tofu, cooked veggies, raw veggies, fruit, they all get stuck on the way down. They make the blades move more than usual because they're getting stuck, which makes you vomit. Then you're told you're just faking it, or you're doing this to yourself, or you had to have done something to cause this. The cognitive dissonance is real, people. So you choke down the food that you know is going to be excruciatingly painful to make the comments stop, which means for the next at least 48 hours, you're going to bleed more than usual. You're going to be in more uncontrollable pain than usual. You're going to want to lock yourself up in your house, call out of work, possibly go to the ER for pain management, if you can make it to the hospital. A lot of people can't. And for the entire time after you choke that food down, you're just hoping that the worst has already passed, but you don't know what the worst is going to be or what it was. But for you, mashed potatoes don't hurt. Jell-O doesn't hurt. Broth doesn't hurt. No one can live on that. And those are just your safe foods. You've met several people in support groups for people with IBD who cannot handle those foods. Those foods make their blades move, but they can handle foods you can't touch, like applesauce or plain cereal. So it kind of depends on where the knives are and your body's chemistry with what you can and cannot handle. But safe foods are not a healthy diet. And you get judged for choosing your safe foods all the time. You're not getting proper nutrients anymore. The knives are literally preventing you from absorbing anything from any healthy food you may try to eat. So now your bones hurt, really hurt. Like you feel like you're 100 years old. Your teeth and hair fall out. You're anemic. Your nails stop growing. They might even fall out. Your muscles weaken. You might lose your ability to walk. You physically cannot stay vertical, let alone awake, for more than 1 to 2 hours at a time, which means you might lose your job if you even have one. Your body is shutting down from malnutrition. Meanwhile, everywhere you go, you're told to suck it up. You're too young to be so tired. You haven't done anything to be so tired. You're so lazy. You're a faker. These are things we hear every day. And we're trying our hardest to stay alive. So then you finally find a doctor that will listen to you. You choke down at least a bottle like this of bowel prep. And you get a colonoscopy and an endoscopy. So you are put to sleep and you are made a human shish kebab with cameras. So the doctor can see the blades on the inside. And they're wondering how the hell you are not tearing yourself apart from all of the pain. So you're prescribed mesalamine and steroids. Usually the steroids are prednisone. The mesalamine helps dull the pain from moving with the blades day to day. The steroids help you gain an appetite, and they reduce the internal swelling from the blades on the inside. Now you're packing on pounds and you can't control it, and your bones become weaker at the same time, and more judgmental comments come pouring in along with, "You look so much better." We're not better. You are not better. You couldn't feel worse right now because you're adding on weight that your bones and muscles cannot hold up. And the doses keep getting raised to try to control these blades that only you can see. Eventually, the medicines may stop working. For a lot of people with IBD, they do stop working. So your doctor starts you on a form of chemotherapy. Let's say Remicade. All right, so you start going to the infusion center and you're getting pumped full of Remicade every couple of weeks to control the inflammation and the autoimmune response towards all of your digestive organs. You're told by others, chemo's for cancer patients. You don't have cancer. You want to rip into them so bad for judging you. But you have no strength left. You are going day to day wondering why you're still breathing. How are you still alive? When it gets bad enough, and after a lengthy, possibly months-long fight with your insurance to prove how severe this is, you might find a skilled surgeon to remove some of these blades. But it's not that easy, because as every single knife is removed, where that knife is poking, that part of that organ has to be removed too. So let's say you've got 4 blades right in your duodenum. Your duodenum's coming out, honey. And your small intestine is about to be hooked right up to your stomach, which means you're not absorbing things properly, even worse than before surgery. But you're in less pain, right? You don't have those knives anymore. Or maybe you lose an entire intestine. Entire colon, boom, gone. Or entire small intestine, boom, gone. Beautiful, right? The miracles of science here, people. It's the only reason some of us are still alive. With all of these surgeries, you might need an ostomy or a feeding tube, because now you go from point A to point B way too fast to absorb anything, and the only way you can get any nutrients is TPN. Then people might take you seriously. But then they begin to insist you're cured now. You had surgery, you had the trouble part removed, right? The rest of the knives are still there. You might have lost these two. Everything else is still there. But again, you're the only one that sees it. And you're still taking medicine to control the rest of the blades. You just got rid of the most troublesome blades with that surgery. You're still in agony. You're still not absorbing things properly. You're absorbing things worse than before sometimes. You still experience daily fatigue and brain fog. And the knives love to play in surgical sites. So you might get stabbed again and again where you just had knives removed. And the cycle starts all over. This is forever. IBD doesn't truly disappear. We may reach remission, but that just means we're currently not being stabbed. It doesn't mean these blades went away. We're in clinical remission. And we still have to take maintenance meds to keep it from spreading. We still have to fight with insurance for those meds and other treatments. And it's to function. We keep it from spreading. We're trying to stay on top of it so we can keep our digestive tract. This is not and never was a pooping disease. You might have knives in your kidneys or your liver, your bladder. They can be anywhere. Most of them are in your digestive tract. This is an autoimmune disease where our bodies don't think that we need our digestive organs anymore. Our bodies are trying to kill off our digestive organs. It affects everything from our digestive tract to our bones, to our muscles, to our blood, to our brains. If there's anything else you want to add, feel free to put it in the comments. And if you think this helped you, feel free to share it, pass it along. I'm going to go lay down because writing all this out was exhausting.